Somatic system, responsible for moving the skeletal muscles. Autonomic system, controls the involuntary muscles. Muscular system, permits movement of the body. Cardiac muscles, found in the heart only. Smooth muscles, surround or are part of the internal organs. Skeletal muscles, are muscles that people have voluntary control over. Lymphatic system, filters out organisms that causes disease and controls the production of disease-fighting antibodies and white blood cells. Endocrine system, creates and secretes the hormones that accomplish a wide variety of the body. Circulatory system, circulates the blood throughout the body, giving nutrients and other essential materials to the body cells and removing waste products from the body. Digestive system, composed of organs which work to turn food into energy, consist of the gastrointestinal tract plus the accessory organ. Extrinsic motivation, occurs when a desired object or socially enhancing consequences is presented to increase the likelihood that a behavior will be repeated. Tools used are tokens or rewards that use public praise or recognition. Intrinsic motivation is an individual's internal desire to perform a particular task. Stages of change: pre-contemplation, contemplation, preparation, action, and maintenance. Pre-contemplation resists change, not really thinking about or intending to change behaviors. Contemplation, think about changing within 6 months, may be indecisive about change. Preparation, have achieved desire to change but don't know how. Action, have a plan of action, have goals. Maintenance, have maintained the behavior for 6 months. First stage of pregnancy. 1 to 3 months, egg begins to divide within 40 hours of fertilization. Blastocyst, become an embryo after 2 weeks. End of 2nd month, the embryo is a fetus and is recognizable as a human being. Second stage of pregnancy. 4 to 6 months, fetus requires a great amount of nourishment from the placenta. Length is 14 inches and weight is 2 pounds. All systems are in action. It is possible for the fetus to be born in the 5th and 6th months to survive. Third stage of pregnancy. 7 to 9 months, fetus gains most of its weight during this time. Baby needs a good amount of calcium, nitrogen and iron to develop blood and bone, relies on the immunities from the mother's blood. First stage of labor. Contractions are 30 seconds long and arrive every 15 to 20 minutes. Bleeding might occur during this period, includes the transition period. Transition period. The cervix opens all the way. Diameter is about 10 centimeters, wide enough for the head of the fetus to pass through. Contractions are much longer and occur every 3 minutes for 90 seconds. Second stage of labor. Baby is being born. Head of the baby moves into the birth canal. Mother helps push the baby while contractions intensifies out through the cervix into the vagina and then out into the world. Third stage of labor. The baby has been born. The uterus continues to contract until the placenta is expelled. Nuclear family is a family group consisting of one adult couple. Extended family consists of one or more adult couple, often the parents, brothers and sisters are particular heterosexual couple. Hospice, healthcare facilities or agencies that seek to provide care for individuals in their final days. Alzheimer's disease, fatal brain disorder that results in the destruction of nerve cells. Brain is unable to produce neurotransmitter acetylcholine and it becomes difficult for the different parts of the brain to communicate. Dementia. 7% will develop. Chronic inability to assess one present situation. Person often seen confused and disoriented. Barbiturates. Drugs that slow down the central nervous system and in the beginning stages of use reduce physical and mental tension, decreases alertness and introduces drowsiness. Inhalants. Drugs taken into the body through vigorous inhalation. Example, huffing. Amphetamines. Powerful stimulants can be extremely addictive and dangerous to health. May be snorted, smoked, injected or orally. Stimulates the central nervous system and raises the heart rate. Hallucinogens, substances such as LSD, mescaline and psilocybin that create profound changes in the mind's ability to function. Stimulants, sometimes called uppers, increases alertness and energy, example, cocaine. Depressants, drug that lowers neurotransmission levels, which is depress or reduce arousal or stimulation, example, alcohol. Malfeasance, occurs when the teacher has committed some act which is against the law. Misfeasance, when the teacher obeys the law but not enough to prevent injury. Nonfeasance, occurs when a teacher has failed to perform some act which could have prevented an injury to a student. Contributory negligence, occurs when the injured student is in part to blame. Comparative or shared negligence, occurs when both the injured student and teacher are to blame. Avoiding injuries in school and physical activities. Avoid mismatches in competitive games. Students should fill out a waiver form for activities that are to be considered dangerous. Students need to undergo a medical examination if there is a possibility of a health condition that puts the student at a greater risk of injury. Formative assessment. Testing that a teacher carries out aims to ensure that students understand the material and to diagnose gaps in understanding. HIV. Virus that destroys body's cell-mediated immune system and makes the individual extremely vulnerable to cancers and other infections spread by vaginal sexual contact, anal or oral sex or sharing of needles. AIDS weakens the immune system of the human body. UTI. More women have it than men. It's a burning, painful urination, chills, fatigue, fever, and blood in the urine. Mononucleosis. Viral or virus found in people 15 to 24, spread by kissing and close contact. Symptoms of mononucleosis: sore throat, headache, fever, nausea, and prolonged periods of weakness. Influenza, extremely contagious, very similar to the common cold. 2 types A and B. Type A is to be considered the most dangerous. TB, potentially serious infectious bacterial disease that mainly infects the lungs. NGU, inflammation of urethra that is not a result of an infection of a gonorrhea, most common in males. Chlamydia, bacteria infection in young women. Symptoms of chlamydia: vaginal and urethral irritation, itching, painful urination, a slight discharge. HPV causes genital warts, most common viral STD transmitted by vaginal, anal, or oral sex. PID, infection in a woman's fallopian tubes that is so severe that it can harm fertility, sometimes permanently, not a sexual transmitted disease. Syphilis, bacteria base that prospers in the warm, moist tissues of the reproductive system. Primary syphilis, lesion appears at the precise location where the bacteria entered the body, about the size of a dime. Secondary syphilis, victim may develop a rash, whitish patches on the mouth or throat, a fever, or large sores on the mouth or genitals. Latent syphilis, bacteria attacks the organs of the body. Herpes, virus transmitted by contact with an infected area, never goes away but will return from time to time throughout the life of the host. Herpes simplex 1, causes cold sores and blisters around the mouth. Herpes simplex 2, blisters in the genital areas. Gonorrhea, bacteria transmitted by sexual contact and oral sex, can live inside a woman's reproductive organs for years. If left untreated, it can spread throughout the body and cause heart problems and infertility. Diabetes mellitus, endocrine disorder that increases the risk, arteriosclerosis and hypertension. Chancroids, soft, painful scars that are a result of bacterial infection contracted during sexual contact. Cholesterol, found in foods and is made by the body. High level of cholesterol indicates a high buildup of plaque on the arterial walls and could increase the likelihood of a heart attack. Triglycerides, flow through the blood after a meal and are the highest when an individual diet is high in calories, sugar, alcohol and starches. Lipoproteins, are composed of protein and fat. High-density lipoproteins, composed mostly of proteins, gets rid of excess cholesterol, good cholesterol. Low-density lipoproteins lines the arteries with excess cholesterol, bad cholesterol. Hypertension, created by contractions of the heart while it pumps blood and the resistance walls of the veins and arteries through which blood flows. Systolic blood pressure, highest contraction of the heart. Diastolic blood pressure, period of release lowest. Carcinoma, most common kind of cancer, originates in the cells that line the internal organs and the outside the body. Sarcomas, those cancers that develop in the connective and supportive tissues of the body, namely bones, muscles, and blood vessels. Leukemias, originates in the blood-creating parts of the body, spleen, bone marrow, and lymph nodes. Lymphomas, originate in the cells of the lymph system where impurities are filtered out. ADHD, individual has a hard time controlling motion or sustaining attention. Individuals are impulsive, constantly in motion and easily distracted. OCD, individual is plagued by recurring thoughts that he or she cannot escape and may display repetitive, rigidly formalized behavior. Hepatitis, a virus that causes inflammation of the liver. Lyme disease, a bacterial infection spread by ticks. Myocardial infarction, if the myocardial cells which are around the heart and cause it to contract do not get enough oxygen, they may begin to die. Happens when the arteries are blocked by plaque or a clot. Class I obesity, has a body mass index of 30.0-34.9. Class II obesity, has a body mass index of 35.0-39.9. Class III obesity, has a body mass index of 40.0 or greater. Surface reflection, first level of reflection in which teachers use strategies and methods to reach predetermined goals such as maintaining order. Pedagogical reflection, a level in which teachers use educational goals, the theories underlying approaches, and the connections between theoretical principles and practices. Critical reflection, a level in which teachers consider moral and ethical implications and consequences of classroom practices on students. Self-reflection, final level in which teachers examine how one's beliefs, values, expectations, and assumptions impact student learning. 3 phases of motor learning: cognitive, associative, and autonomous. Cognitive phase, first phase of motor learning, development of the overall understanding of a skill. Associative phase, second phase of motor learning, the learner begins to demonstrate a more refined movement through practice. Autonomous phase, final phase of learning, the motor skill becomes mostly automatic. Spatial intelligence, ability or mental skill to solve spatial problems of navigation, visualization of objects from different angles and space, faces or scenes recognition, or to notice fine details. Natural intelligence, ability of a system to perceive its environment and takes action that maximizes its chance of success. Intrapersonal intelligence, ability to understand oneself and one's thoughts and feelings and to use such knowledge in planning the direction of one's life. Interpersonal intelligence, ability to judge and make distinctions on moods, intentions, and motivations of others. Personality types. Type A, B, C, D. Type A personality, associative with being competitive, work-obsessed, aggressive, and impatient, links to high stress, high blood pressure, and high cholesterol. Type B personality. Personalities are generally not competitive, relaxed, happy-go-lucky, patient, and social. Type C personality. Individuals often aim to please others, are not assertive, are perfectionist, deep thinkers, and have an eye for detail. Type D personality. Individuals are pessimists, suppress emotions, are socially withdrawn, and have constant negative emotions and thoughts, linking type D with depression. Sexual harassment, form of unwanted physical or verbal bullying or use of power of a sexual nature with the possible promise of rewards or opportunities in exchange for sexual favors. stalking, malicious following, general harassing or threatening of one person to another. Cyberstalking, use of electronic media to pursue, harass, or contact another person who has not solicited the contact. Bullying, an attempt to hurt or frighten people whom the individual perceives as smaller or weaker. Biomechanics, a study that uses principles of physics to quantitatively study how forces interact within a living body. Kinesiology, the study of human movement. Anatomy and physiology, the study of location and function of the parts of the human body. Exercise physiology, the identification of physiological mechanism underlying physical activity. Movement concepts, the ideas or modifiers that enrich the range and effectiveness of a movement, relate the quality of the movement, describing how the skill is to be performed. Body awareness, space awareness, effort relationships. Body awareness, the knowledge of body parts, what the body parts can do and how they can do it. Space awareness, where the body moves, the ability to make decisions about an object's positional change in space. Effort, how the body moves. Relationships, relationships with whom or what the body moves. Skill level, proficiency, utilization, control, and pre-control. Skill themes, fundamental movements that apply to many different sports and physical activities. How they are used depends on the sport or physical activity. Components of health-related fitness, muscular strength, muscular endurance, cardiovascular endurance, flexibility, and body composition. Components of skill-related fitness, agility, speed, reaction time, balance, coordination, and power. Fitts law. Width of target increases the accuracy and greater the distances decreases the accuracy. Practice variability, variety of movement and context characteristics a person experiences while practicing skill. Blocked practice, practicing one skill for a period of time. Masses practice. Serial practice, practicing a skill for a short period of time but in a specific order. Distributed practice. Random and serial practice fall into this category, short practice periods with variety. Mental practice. Cognitive rehearsal of physical skill in absence of overt physical movements. Knowledge of performance. Augmented feedback that provides info about the quality of movement performance. Knowledge of feedback. Augmented info usually provided in verbal forms after the action is completed, provides info about performing, reaching the desired goal, also known as kinematic feedback. Intrinsic feedback, internal feedback received during and after the execution at task. Extrinsic feedback comes from external feedback, also known as augmented feedback. Concurrent feedback occurs while the performance of the skill is in progress. Terminal feedback, after the performance is concluded. Putting discrete skill in a series, skills with arbitrary beginning and end locations. Discrete skill, definite beginning and ending points. Performance effort, when the performer reaches his or her max effort. Persistence, subjects improve performance capability last over a period of time. Consistency, subjects' performance attempts become similar. Kinetic energy, the energy that an object has due to motion. Potential energy, energy that is stored and held in readiness. Skills are never performed in the same context each time. Person knows a skill but makes a mistake in execution of what they know. Invasion games. Any team which players have to penetrate the territory of the opponent and either enter a goal themselves or put a ball of some kind into a goal. Title IX of the Education Amendments Act prohibits the discrimination on the basis of sex in any federally funded education program or activity. IDEA, law that makes available a free appropriate public education to eligible children with disabilities throughout the nation and ensures special education and related services to those children. NCLB, standard base goals for students and teachers. ADA, equal opportunities for people with disabilities. Saturated fats, solid at room temperature develops cardiovascular disease, bad cholesterol. Unsaturated fats, liquid at room temperature does not raise blood cholesterol, low-density lipoproteins. Monounsaturated fats, has greater effect on reducing hypertension. Add-in, server's advantage. Add-out, receiver's advantage. Deuce, even score. 4 phases of the reflective cycle of teaching: plan, teach, assess, and reflect. Eustress, moderate or normal psychological stress interpreted as being beneficial for the experiencer, beneficial stress. Distress, extreme anxiety, sorrow, or pain, physical or mental suffering. Acute stress, stress is brief and usually require immediate response. Chronic stress, can be unrelenting stress and can last up to weeks or even years. Manipulative movements, throwing, kicking, catching, dribbling, and striking. Locomotor movements, walking, running, crawling, leaping, hopping, galloping, skipping, jumping, sliding. Non-locomotor movements, turning, rolling, twisting and transferring weight, stretching and balancing weight, jumping and landing. Piaget stages of cognitive development: sensory motor stage, pre-operational, concrete operational, formal operational. Sensory motor stage. Pre-operational stage, 2 to 7 years. Children begin to think symbolically and learn to use words and pictures to represent objects, tend to be egocentric and struggle to see things from the perspective of others. Better with language and thinking, they still tend to think about things in very concrete terms. Concrete operational stage. The formal operational stage. Steps in the responsible decision-making model. 1. Identify the decision to be made. 2. List possible decisions and share with a trusted adult. 3. Decide which decision is most appropriate. 4. Evaluate alternatives and consequences. 5. Act on the decision and evaluate. Collaboration, when 2 individuals work together only. Mediation, when 2 parties sit down with another unbiased individual to come to a resolution. Compromise, an agreement or settlement of a dispute that is reached by each side making concessions. Empathy, ability to identify and understand the feelings and ideas of another person. Interdisciplinary teaching, strategy that can help a teacher collaborate with a teacher of another subject, combines skills, knowledge, and conceptual understanding in 2 or more subjects or disciplines. Test validity, indicates that the test actually measures what it is intended to measure. Amenorrhea, absence of menstruation. Dysmenorrhea, pain caused by uterine cramps during a menstrual period.